morning, good afternoon, good evening. Welcome to Confluencia Sessions number 2, hosted by the Confluencia, the Advanced Studies Group on Health Information Technology for Vulnerable Populations at the Institute of Advanced Studies, University of São Paulo, Ribeirão Preto campus. I'm Ricardo, your moderator today, and today's session theme is Literacy and Health Digital Transformation, Past, Present, and Future. We are live on YouTube, and please post your questions along the session. We don't have to wait for the end to put the questions. At the end, we will bring to the speakers. A link for the attendance form will be shared during the session. Please fill out the form when you to receive your certificates. The session language is going to be in English. Thank you for joining us. It's my pleasure to introduce our speakers. Professor Tashmi Karunaratne from the Royal Institute of Technology from Sweden, and Mrs. Viviana Torres, Human Capital Leader at National Center for Health Information Systems, Science, from Chile, and Professor Viviana Torres Pisa, Federal University of São Paulo, Brazil. Before we begin, I'd like to invite Professor Cristiane Galvão for brief opening remarks and why this session brings together 3 countries. Professor Cristiane, please, the mic is yours.
Welcome, everyone. Thank you very much to stay here with us in the second Confluencia session. Here we have Professor Tashmi from Sweden, Professor Viviana from Chile, Professor Ivan Pisa from Brazil. In the last 20 years, I have studied digital transformation. And when we talk about this theme, this subject, it's not the same for different countries. We need to consider the population, the economic conditions, education. It's not about only for technology, but we need to understand the society. We need to understand the health system. Today, we have the opportunity to observe different perspectives of digital transformation in health system. Then I invite you to pay attention in our presentations here and also provide questions in our chat in YouTube. Thank you very much and good for us.
Thank you, Professor Cristiane. Well, without further delays, are going to start with Sweden, with Professor Tashmi Karunaratne, that will discuss how a mature digital ecosystem creates new digital health literacy demands for citizens and professionals. Tashmi, please go ahead.
Thank you so much, Ivan, and thank you, Cristiane, and all for inviting me for this seminar here today. And I will actually start discussing a little bit about, as Cristiane said, that when we are talking about digital transformation, we have to sort of take into account the context, the demographics, the socio-cultural aspects, and so forth. So here today, what I'm presenting is actually the Swedish aspect here with specific points to take in as a cultural aspect here, as well as to sort of like show that probably maybe there are some things that we could sort of like share with other demographics as well. So as mentioned before, my name is Tashmi Karunaratne. I am an associate professor of digital transformation in Royal Institute of Technology, Sweden. So I will just start with the overview of what I'm going to talk today. I will just look into a little bit of digital health landscape here, what it looks like and so forth. And also, as everybody, we have some challenges identified already and working on that as well. Also, I would then jump into the main topic of today's seminar here about what is the role of digital literacies when it comes to health, digital health. And also we will I will little bit describe about what kind of activities we are doing regarding the digital transformation in different aspects and so forth. And also a little word about like the way forward as well. So to start with the demographics about Sweden, as we quite know in terms of statistical measures that Sweden is a kind of like early adopter, as we say, and also kind of we have done some kind of milestones, pioneering activities regarding digital transformation or transformative healthcare per se in general. So Sweden is having quite impressive statistics with regards to digitalization and digital transformation, which I'm not going to go through everything, but as we know that the highest part of the society is actually digitally literate in a way, and also they are sort of also accessing the digital healthcare services, including several digital technologies that we have been using, as well as solutions such as the Swedish ER system 1177, we say. And also there are other digital solutions that we have been using in Sweden, almost like out of like 10.6 million-ish population in Sweden. More than 90% of the population has this access, and they have been sort of continuing to do that as well. So when it comes to digital transformation in Sweden, we can think about several milestones in that pathway. We have started quite early in terms of looking at early EHR systems, the electronic health record systems, and the telemedicine attempts that we have been also try to practice and pilot and so forth. And also e-prescription systems has been also kind of like introduced during this time. And when it comes to the era from 2006 to 2014, where we started talking about digitalization and health, especially with respect to healthcare in general, we have sort of also introduced this national e-prescription rollout, and also the EHR system 1177 was launched, and the Swedish e-health agency was established during this period, and so forth and so on. So stepping into the next era where we started talking about the smart society a lot. Then it was this time that Swedish e-health vision was introduced. And also it was aiming at the challenges we have to mitigate, as well as the opportunities we have as a society to achieve the e-health potential and possibilities by the time of 2025. And also at the same time, also the 1177 system, that is the EHR system we have, has also been expanded, thinking more about interoperability standards and how to sort of like make these data repositories that are being able to share with different other contents and so forth. So as we all know, then came into an era of COVID times, where many services has sort of introduced through digital forms. Same went for e-health to the health systems as well, where we could see that a lot of accelerated telemedicine systems has been emerged, and also the vaccination booking system has gone digitalized, and also there were possibilities to remote monitoring of certain illnesses and stuff like that, and also giving telemedicine in remote programs and so forth. That's also kind of emerged during this time. So that has made actually a boost in digital health use in Sweden in general. So when we are talking about the current situation here from 2023 onwards to present, we are mostly now talking about how we can adopt AI mostly, and also European health data spaces. Also, another thing that we have been talking a lot about, how to share health data in a more ethical and transparent way and so forth. Also, preserving the privacy of patients and so forth. And also there are a lot more discussions, especially very recently when they have launched this digital skills agenda in 2024-2025. There was more focus also on how to develop the competency and the skills, digital skills, AI skills, and general other skills that is needed for the transformation. So those are kind of the milestones that we can sort of think about. And also when it comes to the governance in Sweden, it is a little bit kind of different from the other countries, I would say, probably not all the countries, but we have some kind of a decentralized format of service delivery where most of the regional authorities are sort of empowered regarding giving the services, making decisions, and implementing new technologies and stuff like that, with kind of overarching national coordination, of course, going aligned with the EU, the European Commission's regulations and the recommendations as well. And also there is a strong emphasis on interoperability. That means like different health domains and health stakeholders, how they can share data in a more understandable and more kind of coherent way, so that the decision making can be easy and so forth. Also to bring up like with common standards, which are not only related to Sweden, but also in general to EU as well. Also it is quite common here that we are using the identities which are like privacy preserved and secured and so forth. We have like in Sweden a bank ID, for example. It is the national kind of like authentication enabler, so to speak, and so forth. Also, when it comes to governance and the state, governance between the state and the regions are also quite holistic with the overarching vision of the e-health platforms and so forth. So as we also know that statistics say that the Sweden is fourth in the digital economy and society index. So that is also making us a little bit going front forward quite in a quite advanced way in terms of digitalization. So with compared to the rest of the Europe, Sweden is generally has high level of skills, basic and advanced skills both. Especially we are also looking at specifically regarding the elder community here. So what kind of needs that are needed by them and so forth as well is something that is of high importance in Sweden. So again, more statistics regarding healthcare providers. About 15, all the regional healthcare providers and about 15% of municipal healthcare providers, they are producing information to the national portal of patients as well. So this is kind of a good overview in a way. It needs to be, of course, improved and advanced, but it's a good start, I would say. And pharmacies using electronic expert support is a good thing, and we see that it is increasing also. Municipal staff is being trained, and also they have been using mobile devices to operating the systems and so forth and so on. So with respect to the technology trends, we have like increased the use of telemedicine, and then also we can see that a lot of new technologies, disruptive technologies like AI and machine learning tools are being used for diagnostics and stuff like that. So data platforms are also emerging, as I mentioned before. So this is kind of the triangulation that we have in Sweden that is giving more concern, especially in the from the authority wise as well to motivate vendors and the stakeholders in the healthcare provision to go and find more of these kind of efficient and effective ways of providing healthcare. But as we all know that there are quite many places that to be improved as well. Especially the citizens' access to welfare technologies is not as much as that has been sort of expected. So it is very unequal in the across the country as well. So it is basically going into a level that where you can see that a lot of methods and processes for data sharing, security and privacy of patient data, they needs to be strengthened as well. And also we have to also bring in regularity frameworks, especially with respect to AI and data, big data management and interoperability and so forth and so on, especially in line with the EHDS, the European Health Data Portal. It is needed to be improved a lot. It's not there yet. There are pilots, but not kind of really a practical application that is not here yet. The conditions for digital transformation is, of course, it must be improved just because that we have statistics which are not as impressive as we thought. Like, for example, in 2022, 1 of the 5 Swedes could not use healthcare app, for example. So 1 in 10 people could not log into 1177, that is our electronic health record portal. To obtain COVID certificates digitally and so forth. So there are, especially with respect to elderly, the problems are getting quite worse. So one of the main issues regarding the not being able to come into this kind of level that is expected is regarding also about the literacy itself, because many people, the Swedish community is also kind of like changing a lot. There are a lot of immigrants coming in, and most of the healthcare workers are having immigrant backgrounds and so forth, and they might have different levels of their competencies as well. So there is a little bit of a problems that we can see more and more right now. So when we are talking about literacy, we have like 2 different contexts here. One is regarding the professionals, so how we can provide a good systems and solutions for the professionals so that they can use those and so on. And also with respect to citizen and patients, they have to be educated in a certain other way so that they could have this competency and the literacy to log in and access to the tools and learn, to use those tools in the way that we want them to use it. So we have been looking at many aspects in doing that. So what we have done right now is regarding like integration of digital health topics into the medical content in the education, so that healthcare professionals are getting sort of knowledgeable, educated, not like with the knowledge only, but also with the tools and the skills as well. So both are coming in together. So continuous development is being also sort of something that is been thinking of, not like that once the professionals have studied, it's not that they are stopping the learning from there. So it is kind of like continuing afterwards and so forth as well. So this is also going into a level of national level resource repository, so that will be helpful for the professionals to develop themselves and so forth. But when it comes to gaps, actually there are a lot of problems regarding the standards as usual, that it's everywhere. Lack of standards, lack of national-wide curricula, or maybe different levels and different types of knowledge levels needs to be catered as well. And also insufficient training data to interpretation and algorithmics bias and ethics when it comes to use of technology, and especially AI. Actually, we need a lot of data to train them and so forth. And also to be able to learn and know about that also is a problem. And need for the practical workplace embedded learning and assessment tools are also needed, which is a quite huge gap right now, actually, because there are quite limited avenues that both the professionals as well as the users has in order to learn about these technologies and tools and so forth that are being used. So this is kind of a huge problem still here in Sweden as well. So as I said before, migration is making this problem like scale up, and also it is getting worse, I would say, unfortunately. So there are different types of caretakers and the doctors and so forth. They are coming from different backgrounds, may not be having the same levels of competence that we expect. Also, when it comes to digital tools, it's always the problem of risk of exclusion, especially like in Sweden, we have this problem of, as I mentioned before, the migrants, which also making it another problem when it comes to demographic changes in Sweden is that we need multilingual portals, because Swedish is not only the language that people are using in Sweden anymore. So these are kind of problems that we have to sort of somehow address. So we are talking about like many different ways of training. How do we do this kind of what you call the mass individualization? You just sort of cater to many people, but for individuals, they are being sort of specified for the individual when it comes to the knowledge level and the background and capabilities they have and so forth. So we are also trying to introduce new different ways of learning as well, not as a normal traditional way of education. So when it comes to the types of developments, we are thinking of modular curriculum-based approaches where content is mostly about digital literacy, AI use, data practices, responsible AI, and so forth, because it is needed to be contextualized in that ways as well. And also we are focusing on need-based as well, because some groups need different aspects than the others and so forth. So how to cater them in a more specialized way is something that we are looking at as well. So we are here mostly talking about AI-based solutions and technology-enhanced solutions as well. So what we do right now is mostly regarding, as I said before, we give a specific focus for the older people. And then we closely work with municipalities. That is where we can actually easily get the needs from the locals, from actual practice domain, so to speak. And also we are exploiting new ways of learning, training, using new technologies as well as disruptive technologies. How can we use this disruption to make the things better and so forth. And we are also looking at subject-specific training, like with respect to security, privacy, data sharing, and so forth, because there are different entities that are been focusing on these different matters. So they have to be educated as well. In a more specific way for their domains. So that is pretty much it from me. I hope that I didn't take so long. And if there is any question, I'm so happy to answer. Thank you.
Thank you, Tashmi. As I said before, if someone has any questions, please put on the chat. And after the last speaker, we will take all the questions together. Now we'll move to Chile with Mrs. Viviana Torres, Human Capital Leader at the CENS, the Chilean National Center for Health Information Systems, which will focus on workforce competencies, leadership development, and change management for digital health. Mrs. Torres, please, the mic is yours.
Thank you so much. And good morning, everyone. It's a pleasure to me to be here. I'm going to talk about the importance of digital health competencies and necessity for the digital transformation of future clinical professionals. As an introduction, I had to say maybe we have to ask for a question, why talk about digital health competencies today? As we all know, digital transformation is present in every aspect of our life. The transformation it brings cannot be addressed only from a technology perspective. This growing degree of digitalization requires specific digital health competencies for clinical professionals involved in healthcare delivery. So the digital transformations in healthcare is not just about technology, it's about people. A competency, I'm going to start with the concept of competency. A competency is a set of knowledge, skill, and attitudes that enables individuals to address a situation or problem in an integrated manner, acting appropriately and taking responsibility for its implication. So we have here three concepts that we know, we have to know, that is knowledge, and answer the question, what one knows, skill, what one is able to do, and attitude, how one behaves or responds. So the competencies are needed to define and install curricula in careers, articulate undergraduate, graduate, and continuing education, detect gaps in personal and team training, and define quality skills and recognize job profiles and training paths. So as healthcare system evolve, digital health competencies are no longer optional. They are essential for safe, effective, and equitable care. So digital literacy, health literacy, this is another concept that we have to know. Digital literacy in health refers to the ability of individuals and health professionals to effectively use digital technologies to access, understand, evaluate, and apply health information. The World Health Organization, digital health literacy is essential for promoting health and well-being for all at all ages, empowering people to make informed health decisions, and supporting the safe and effective use of digital health solutions, bringing gaps in access and equity in healthcare delivery. And it's important to know and to have these two concepts in mind, because we are going to learn, we are going to work with this competence. So the World Health Organization, in its global strategy, emphasize the integration of digital health competences into the education and training of health professionals and allied workers. This is to strengthen digital capacity among 4 key groups. So the policy, planners, clinical professionals and providers, populations, patients, and communities. These frameworks guide curriculum developers, digital leaders, and practitioners on how to design, assess, and implement digital health solutions effectively. So here we are going to go to the past and to know what are the foundation of digital literacy. Historically, digital literacy in healthcare focuses on basic ICT skills and access to online health information. Challenges include limited infrastructure, resistance to change, and unequal access to training. In the past, digital literacy was often seen as a technical add-on, not a core professional skill. And now, in the present, we have competency frameworks, our emergence of structure frameworks from several organizations, and these frameworks define key domains such as health information system, data governance, telehealth, digital communication and collaboration, ethical and legal considerations, and use of artificial intelligence and decision support tools. These These competences are increasingly embedded in health education and professionals' development programs. And now on the future, what we expect of the future, a digital-enabled workforce. Digital health will be shaped by artificial intelligence and machine learning, precision medicine and genomics, digital therapeutics and wearable technologies, interoperability, and data-driven decision-making. To prepare for this future, we must foster lifelong learning, interdisciplinary collaboration, and equity and access and digital tools and training. So here in Chile, the National Center of Health Information System, known as CENS, plays a key role in driving digital transformation in healthcare. Established as non-profit corporation by 5 leading universities in Chile, and aims to improve healthcare delivery through the adoption of digital technologies. CENS operates across four several strategic areas, like as interoperability, quality, innovation, and capital human talent. Its mission is to foster the development of digital health by building human capital, promoting collaboration, and strengthening the ecosystem of innovation, and is a national and regional reference point for digital health, supporting both public and private sectors. And in a sense, we are developing a model, the reference, the digital health competencies model, and this is created by CENS. Over the past 6 years, CENS has led a collaborative and evidence-based process to define, implement, and refine digital health competencies aimed or tailored to the Chilean context. Starting in 2019 with the first model of the health competencies, digital health competencies, and this model focus was on participatory and context-aware training. Each year brought new milestones, from the definition of professionals profiles in 2020 to the creation of training programs and institutional consultancies or interviews in 2021, and the expansion to the universities and technical education in 2022. And in 2024, the model evolved into version 2.0, incorporating insight from innovation, workshops, and post-pandemic review. Today, this model serves as a reference framework with over 250 professors training across 14 universities. This model reflects CENS' commitment to the support digital transformation in healthcare by building human capital and strengthening institutional capacity. And here, for the development of version 2.0, 61 professionals were involved, including clinical users, ICT specialists, and digital health experts, who helped prioritize the most relevant competencies through content analysis. And we have here the model of referential competency model in digital health, the version 2.0. And this model serves as a strategic framework to guide the development, implementation, and evaluation of digital health competency across various professionals' profiles. This model, in CENS, has 9 domains. One domain is across over all the other ones, has 104 competencies in total, and it's focused in four users. These users are individuals who actively participate in this digital ecosystem. And these users are decision makers, clinicians, informaticians, and patients. And patients are to come because we are not developed yet the patient's competencies. And how can use this model? And this model, this slide illustrates how the referential competency model can be applied both vertically and horizontally. In the way of vertically, it addresses the specific competencies required by different user groups, such as decision maker, clinical professional, clinical users, ICT, and so forth. And transversally, it expands across key domains of digital health, including governance, innovation, telehealth, and data use. And now, what are the benefits of the model? Promote user-centered digital transformation by focusing on the key actors within the health ecosystem, address contextual diversity, including cultural, linguistic, and socioeconomic factors, supports equitable access to the digital health tools and service, strengthens digital health literacy among professionals and communities, facilitates system integration, helping to overcome fragmentation in healthcare delivery, and encourage adaptability and innovation, preparing professionals for ongoing technology change. So as conclusion, we can say investing in digital health competencies is not just a strategic priority, it is a necessity for building resilient, equitable, and future-ready health systems. The references competence model provides a robust framework to guide education, training, and institutional transformation, but its impact depends on how we implement it across sectors, disciplines, and communities. So thank you. This is my presentation, and here, if you don't have yet or now the model, you can download in this QR. Thank you so much, and I'm able to answer any questions.
Thank you, Mrs. Torres. I think that one of the questions was already answered with this link at the end. Well, from now, from Mrs. Torres, we'll go to Mr. Torres, Professor Viviana Torres Pisa from Brazil. He's going to talk about workforce, frontline practice in resource constrained settings. Okay, Pisa, please, the word is yours.
Good morning, everyone. Thank you, Ivan Riccardi. First, I'd like to thank the Confluencia Advanced Studies Group for this kind invitation, and our moderator, Professor Ivan Riccardi. All the Ivans meet together today. It's an honor to be here today alongside my colleagues, Professor Tashmi and Professor Viviana. Thank you. My name is Ivan Pisa. I'm professor from Federal University of São Paulo. I will be sharing to you today the journey of our project, Health Digital Intelligence, also known as IDS test. As we hear the valuable perspectives from Sweden and Chile, it's important to contextualize the challenge we face here in Brazil. This is primarily one of scale. To put in perspective, Brazil has a population of over 200 million people served by our unified health system, SUS. This comparable to about 19 million in Chile and almost 11, I think, billion in Sweden. So the task of assessing and evolving digital literacy for such a vast number of professionals and students from health area is a challenge from a different magnitude. So I'm going to show some studies and projects we are facing here in Brazil. I will talk about these 3 phases of our project. We are conducting here in Federal University of São Paulo, also with colleagues from Federal University of Maranhão and Fiocruz. And first, we started to evaluate digital literacy in this first phase of the project. We have the same challenges that Professor Viviana and Professor Tashimi show us. But we started with an information literacy perspective. So we adopted this digital literacy concept, but we started to apply this with the Health Informatics specialization course from Federal University of São Paulo. And we are trying to assess the digital literacy of these students for the first instance. This specialization course was offered for more than 700 enrolled students all over in the country. And we wanted to identify these competencies regarding the use of digital technologies for health purposes. So we conducted this. I was the coordination of this project, and Gilberto Branco also was the researcher, and we have a team of collaborators. And we, as I just said, we started this with this information literacy perspective, because there was no, at that time, there was no, it's not clear about all the competencies that we have to measure and to identify in these workers in the healthcare and hospitals and in primary healthcare here in Brazil. So we adopted these three methods, 3 questionnaires that we studied, and the UMAS is most known from these 3. We also found this digital literacy self-assessment from Westminster University from England, and this digital literacy assessment from the Microsoft Digital Literacy Project that I don't think it's already running, but it was very popular in that time. We built a questionnaire about 30 questions and took 20 minutes to measure this. And we measure, in principle, the digital literacy in general of these respondents, in the academic studies and learning, in professional activities or work, employment, and personal experiences in social entertainment activities, not exclusive in healthcare purpose. We analyze this with descriptive statistics using K-means, and we worked with 6 indicators, and we have this kind of results. We have more than 500 students that answer these questionnaires with average of this digital literacy 7.1, and we could find in this appliance that what the first characteristics of this digital literacy, that this kind of I have to mention that these students of this specialization, the most of it, they work in the unified healthcare system in Brazil. So we have not only healthcare professionals, but IT professionals also. So we could analyze these several profiles from these students and to categorize it for this level of the literacy, and also for the level of importance of some topics that we collected from these 3 questionnaires that composed our methods. Well, so these results in that time guided the decisions by the course coordination and tutoring. Is not a self-structured course. We have human tutoring in this course regarding the choice of materials and the best approaches to be used. We pointed out which students and the centers, the remote centers, need more technological support, and we indicated most use habits and research. And we supported development of a study plan with tools to add the course and content development. So this first phase, we focus primarily in this kind of context of this specialization. In the phase 2, we took a step forward, and we assume a framework completed about literacy, considering the set of knowledge, skills, and attitudes related to reading and writing as well as productive practice, just like other countries have been done. And we assume the digital literacy, but also we apply this kind of concept to the health purpose and the health contents, considering the Brazilian digital health strategy, and that has mainly included the infrastructure and human research areas. And this strategy contains objectives for expand access, qualifying health teams, and define professional profiles in competency matrix, just other national strategies in other countries. So we adopted this digital intelligence conscience. It's I think it's 19, the DQ Institute from Singapore. They published a framework that is an evolution of the intelligence conscience and the emotional conscience, considering the digital society that we are living, and we adopted this kind of concept, and we decided to make this objective to assess the health digital literacy of students and workers. In this phase, we expand our population and also consider it health professionals that are not doing our specialization course, not enrolled students. We expanded this application, and we want to identify the respective digital competency profiles and establish a scale of their measurement. Sorry, my English is not running very well right now. So Gilberto have been working with me since phase 1, but in phase 2 also, and it was his master's in science degree. We also have Paulo Lopes, co-advisor of this research, and other research of our research group. And we assume the completed standards from this DQ Institute, and also this framework have been considered a standard in IEEE in 2020, a digital intelligence standard. So we made 2 versions of this questionnaire, the alpha and the beta versions. The alpha considering 44 questions, and it took about 30 minutes to be applied. And the second one, the beta version, includes 56 aspects of the digital literacy in healthcare, and it took almost 40 minutes to be applied. And we adopted these 3 profiles: the digital citizenship, the digital creativity, and digital competitiveness. So these 3 profiles, different at levels, but considering different perspectives of the competencies that these workers in healthcare should have these abilities, knowledge, and attitudes to better apply the digital technologies in their work. So we have been working with these 3 kind of competencies in digital literacy: a media and information literacy, a content creation and computational literacy, and data and artificial intelligence literacy. I have to mention that the digital intelligence framework has 8 areas. And we started with 7, the digital literacy, because it was more suitable for the content, the context that we adopted in this study. So all these areas considering knowledge, skills, and attitudes and values inside each one. The digital intelligence framework, fully showed here in this picture, has 24 competencies described, and we started with this green one, the 7, the digital literacy in the right of the picture. And consider that if our model has good results and the statistics validated, we will work with other areas. We build a website to apply this questionnaire, and all in Portuguese. Sorry, we don't have this yet in Spanish or in English, but we have a lot of respondents on the alpha version and beta version, and we begin to establish these statistics, the envelope of these statistics, to understand what is the median and the profiles that have been that we can see and can evaluate in this kind of students and workers in the healthcare field. I have to mention that we are always talking about digital literacy, but we have no baseline about it. We have different frameworks, but we started to make this proposition of a baseline that we can make new decisions, to make new training, and considering this kind of framework. So we are now in this phase 3, and we are evolving this project to the digital intelligence fully framework. We are also with a special focus on primary health care, and we are considering also the demands that comes from our unified health systems digital program that has a focus on the multidisciplinary approach. Right now, the objective of this project is to assess the digital intelligence in health of students and workers, and to provide the open and free web portal with self-assessment tool we call IDS test for digital health literacy and digital health knowledge for primary health care workers, to offer learning paths on digital health literacy and digital health topics for these workers based on the relation between the IDS test results and formal and non-formal education process available in Brazil, preferably produced or funded by the public sector, and to evolve the IDS test within the concept of digital intelligence in health to support effective strategy for continuing health education, both formal and non-formal for these workers. We have now an expanded team working with us, and we adopted fully this I3E digital intelligence standard. We have now, I think that is 63 aspects from this digital literacy test, and we don't have this now. The 2023 version of this framework considers the digital connectivity profile. We are implementing this right now, that expands the 24 competencies to 32 competencies. We are also focus in digital literacy, this green area here in the right side of this picture. And we are planning to go to next year to all 8 areas here. The results that we are achieving, it's a new website. We have been analyzing the results to identify these profiles, and now there are several groups that are intended to apply this test with closed groups to understand the profiles inside a hospital or a municipality. We have been studying the path that of the answers and the profiles that we are getting. And right now we have this kind of results with almost 2,000 respondents answers that we have obtained in this project. We have some expectations, of course. We have the scientific impact expectations to propose a conceptual model on digital intelligence in health, measure the profiles of digital health literacy and digital health knowledge of individuals and in groups, and provide learning paths related to the results obtained in the tests for the individual. For the technological impact, we are providing a free and non-commercial open access web portal in harmony of the SUS digital program and the digital health strategy here in Brazil. And we provide an open access digital catalog of educational institutions and research that promote the development of necessary digital competencies. It's in the beginning, this part of the project. And we also expect a social impact to support students and managers, health professionals, civil society, and other actors, and to propose a micro-credential model for continuing health education via distance learning. Thank you very much for your attention.
Thank you, Professor Pisa. Well, we'll now have time for some questions, but before I remember everyone that the link for the attendance form is on the chat. Please answer it to get your certificate. Okay, we do have some questions from the audience, and if you have many more questions, please put in the chat while you answer these previous questions that were here already. And I think that the first one is from Professor Sabatini. It was addressed to Professor Tashimi originally. How do you deal with immigrants who are not yet fluent in Swedish?
Yes, actually, there are different ways that the Swedish government and regionals as well as the municipalities are dealing with this issue of like how to integrate and include immigrants in the care process, care services as well as care receival. So when it comes to care provision, the professionals who are immigrants who want to come in as a professional in the health domain, there are specified programs which are quite like lifelong learning style courses that they can sort of take and have a quite quick competency regarding the healthcare provision actually. So in that sense, it is while it is on one hand the language courses are getting mandatory and there is some kind of grace periods that they are giving, like for example 2 years and so forth in order to learn the language, but also at the same time they are also providing continuous training on different other languages as well. So there are material that is available with other languages so that those who are sort of, while they are getting on board with the Swedish language, they can develop their competence in their own ways as well. So this is one approach that they've been sort of using. And also when it comes to general public, of course, it is kind of the literacy that is mostly focusing on. And Sweden is already kind of a digital society when it comes to like service provision in general, not only healthcare, but in general, even if you want to get a birth certificate or something like that, you have to sort of access it in through digital forms. And everything is being sort of done through mobile ID and so forth. So it is needed to be trained in such a way that it is more or less like training by doing, so to speak. So you have to sort of like together with somebody else, you train first and so forth. So that is how this kind of onboarding can happen. So what we do in regarding complementary to what the methods already there are available is that we just try to make the learning provisions more efficient, trying to create micro-learning solutions, trying to incorporate AI a lot into material development and so forth, so that if somebody don't understand Swedish word, they can look at in their own language or English and so forth. So these kind of ways are the ones that are being sort of trying to include into the processes. Some of them are there, but some of them are not yet.
Thank you, Ashley. I think that you can also extend this question to the other speakers, because this is a common problem in several countries. So, Viviana, have you faced this problem also in Chile?
Yes, we have the same problem, and in sense we trying to develop the models, the profiles, to get more to have more people with the formation on digital health competencies. So I don't know if that responds the question, but the sense always is focused in digital health transformation. So we are trying to go with these competencies to the universities, to the workers, and to another areas as well to support the digital transformation.
Okay. Ivan, would you like to comment?
Yes, thank you, Professor Sabatini, for the questions. In fact, we are not dealing with that in our project. We are yet in the phase of validate our model. And I have to make a distinction. One thing is digital health competencies for the workers that are evolving the health systems to a new to digital systems. Other kind of competencies is we say in Brazil, in Portuguese, one thing is a literacia em saúde digital. It's a digital health literacy. Other things is literacia digital em saúde. Digital competencies, digital literacy for healthcare purpose. It's a broader concept. So all this kind of these two ones considers Professor Sabatini that the people have this know Portuguese very well and it has a minimum level of literacy, not exactly health literacy, but literacy in general. So we are not considering this approach right now. But we know that we have here in Brazil, I think it's more often that Chile and Sweden, several immigrants working in our health systems. We will have to face this challenge, I think, next year, of course.
Thank you. We have another question here from Chloe Furnival, which was also addressed to Tashini originally. Have older health professionals, 5 years older and more, being able to incorporate digital technologies into their work routines? Because you said that for the new professionals, it's already in the curricula. And about the older professionals?
Thank you for the question. Yes, actually, in terms of when it comes to the professional development programs, especially what we do in Sweden is that we have been using digital technology in the formal education systems from quite a long time now. Even before the COVID, we had a quite high technology enhanced learning programs, especially in the medical field and engineering field. So when it comes to the professional level, they have been sort of already onboarded in technological solutions that using in their practice works, so forth, from the time during their university, during the time of their internships, and then during their professional times. So adding new technologies might not have been as difficult as introducing new technologies from transferring from the completely manual process to digital process. So in that way, the integration has become a little bit easier. I wouldn't say that it is very easy, but it has become comparatively easier to introduce new tools and technologies as it comes in. Like, for example, now we are talking a lot about AI, and we know that medical professionals already are using by their own some AI tools which are available online because of the possibility that they can have access, and their connectivity is very good in terms of most of the places in Sweden and so forth. So these are making little bit of the infrastructure wise itself a little bit of boost of using these new tools and technologies. So we haven't at least seen that much of a resistance to accepting these new technologies, whereas basically all these programs which are sort of meant to increase the digital usage in their work forces. They are quite also coming from the perspective of the opportunities that can be created through technology. I think that is kind of the motivational factor that we can always bring up when you say that, okay, that you use these technologies or these kind of solutions instead of the usual practices you have and so forth. So I think those are kind of the factors that is affecting not having that big of a resistance in general, so to speak, in using technologies.
Thank you. And also a quick view from the other countries. How do you deal with older professionals in terms of digital health transformation? Viviana? Could you share your comments?
Yes. So the sense we don't have a relationship so close with the ministry. We are not part of the Chilean Ministry of Health. We just we act as an advisory organization providing technical expertise and strategy support in digital health methods like interoperability, and we support as the course for the professional that work in the ministry. So the relationship with the ministry is just an advisory. We are an advisory organization, but we are not part of the Ministry of Health.
Okay. I think that is the answer to the question from Cristiane Galvão of the science relationship with the Chilean Ministry of Health. Okay, I do have a question for all the speakers. Since Confluencia is a group with focus on vulnerable populations, could you please talk a little bit which are the vulnerable populations in your country and how your initiatives address these populations? I think that you can start with Tashmi, then Viviana, and Professor Pisa to close. Tashmi, please.
Yes, thank you for the question. There are different ways that we are, or at least the health ministries and the municipalities' health departments are dealing with this problem, with especially immigrants and also vulnerable groups in terms of like other vulnerabilities in the society. So when it comes, Sweden in general is some kind of a non-hierarchical country, so to speak. So it is being sort of like legislation-wise, it is providing some kind of a structure to serve everybody the same way and so forth. I hope that every country is like that, but we are quite mainly focusing on that always and emphasizing on the fact that the level of the society and sort of like equality of when it comes to the knowledge levels, when it comes to the education levels, when it comes to the ethnic levels and all the other sort of differences are being sort of trying to minimalize. That has been said, when it comes to focusing on different other groups, how to support them specifically, we are basically looking many community-based approaches as well when it comes to providing support, and also we try to sort of introduce different other support and facilities, especially our social care, the welfare system in Sweden is a little bit more focusing on how to integrate these groups in general. Now I'm talking about very general focus in general in Sweden, not like specifically what we do. But when it comes to what is our attempt regarding making a literate health society of with a very good health literacy, that what we try to do is we try to use different technological supports in order to first to locate them, to understand their needs and so forth and so on, but without also breaching their privacy per se, and also to make them sort of like feel secure to come into these possibilities that that they can get help from and so forth. So there are quite many initiatives that are happening around also regarding that, how to make everybody included and how to support those others who are not being sort of served well. But as I said in my presentation also, still there is a misalignment, and then there is a gap in also to address. That is why we are trying to see that how technology could be more efficiently included in order to make it better.
Viviana, please.
Thank you for the question. In Chile, the vulnerable population include older adults, people living in rural or remote areas. Chile is a long country, so we have a lot of remote areas. Individuals with disabilities and the people who have problem with the access to the technology. And so at sense, we support the Ministry of Health and other stakeholders by providing guidance or inclusive digital health strategies, like promoting interoperability, usability, to equally the digital health solutions to ensure that this population are not left behind in the digital transformation of healthcare.
Thank you. Professor Pisa?
I think that here in Brazil, we have a scenario similar than Chile, more than Sweden. And we have the same aspects, Viviana, here in Brazil. But this kind of the gender and the rural areas and the older workers, we have in fact the major vulnerability is the low digital health literacy that this kind of workers has. In our project, we already in the past we applied our test for citizens and patients, but now this part of the test is closed. We are reviewing it, and we think that in our project, Ivan, we are working with a diagnostic tool. We are not offering training or courses for evolving this literacy. We are making a diagnostic tool. It's the main objective of this project. But we think that we have now in Brazil a lot of projects for offering this training, but the problem is that we don't see people with this baseline, these statistics about the digital literacy levels of these workers. So, and we also know that these workers sometimes do not find the correct course and training for this kind of vulnerability in technology that he has. So we have too much workers to train, and we have more maybe package of this training that are similar for all different profiles of this vulnerability in digital literacy. So we are working specifically in the diagnostic tool and try to make a partnership with people that are offering this training.
Thank you. Well, we had another comment, a question. Professor Battini asking for the material from Chile. I think that Professor Galvão has already put in the chat. So we are closing our session. And before we close, we'd like to ask Professor Cristiane Galvão to present some closing remarks.
Well, first of all, thank you very much for a wonderful presentation. We need more time to have a good conversation about your presentation, but in few words, First of all, you need to understand that digital transformation involved preparing people, patients, health professionals, students, teachers for this transformation. I need to put a highlight in some comments that you present today. COVID as an accelerator for digital transformation, I believe that is an important point because here in Brazil and in other countries, the pandemic periods was very important for health transformation and digital transformation. I like a point of decentralization of digital transformation that Tashmi presents here. We need that decentralization is very important to consider the specificity of the population and communities, but with a national coordination. I observed that Tashmi talk about the cooperation among different countries in Europe. And I asked me if in Latin America we are collaborating with us. Maybe we need more collaboration. I believe that today we have a wonderful example provided by Viviana with this work that we can use and in Brazil to consider new researches and new data from Brazil, that we need more collaboration, cooperation here in Latin America. Another aspect that I put a highlight is in the unequal use and access to digital solutions. It's very easy for many institutions say we have an app, a software, a digital solutions, but we need to consider that we have many people that don't have the conditions, the knowledge, the education to use this solution. Another aspect that I put a highlight is in the Viviana presentation when she talked about digital transformation is not a transformation of health, but a transformation of life. Then we need to consider all aspects of life, education, social aspects, etc. Considering the education, I believe that Ivan has present for us a good research here in Brazil. We can observe here that we have many kinds of problems also in our education. Many institutions need to consider develop more and more researches regarding the higher education, but also in the basic education. Then I am very happy with our section today and need to thank you, Professor Tashmi, Mr. Viviana, Professor Ivan Pisa, to stay with us, and also Professor Ricardo for moderating today's session. Thank you very much.
Thank you, Cristiane. Well, on behalf of Confluencia and USP, I would like to thank our speakers, Tashmi Karunaratne, Viviana Torres, and Ivan Pisa, as well as Cristiane Galvão for the opening and closing remarks, and also to everyone that has joined us. I would like also to remember everyone to fill the form for the attendance certification. And before we close, I'd like to invite everyone for the next Confluencia session that is going to be on November 18th at same time, 9 a.m. Brazilian time, which is going to be about the population and climate change, the role of education, information, and technology. We have to invite the speakers, Camilo Darcy from Universidade de Santa Cruz, in Brazil, and Vikas Kapil from Emory University from the United States. And the remarks will going to be by Cristiane Galvão, opening remarks, Vitória Fernandes, closing remarks, and the moderator is going to be Flávia Oliveira do Prado Vicentim from the USP Innovation Agents. Thank you everyone for being with us today. See you at Confluencia Session number 3. Have a great day. Bye-bye.